Hello, welcome to our virtual presentation discussing the collaboration of our Family Medicine Interest Group with the Obstetrics and Gynecology Student Society to organize a women's health workshop. Every year prior to COVID, our Family Medicine Interest Group hosted a workshop to help increase exposure to the wide variety of procedures and examinations done by family medicine physicians. As we planned one of our first in-person events since the beginning of the pandemic, we discussed which topics to cover at this year's workshop. It was mentioned that many preclinical students are uncomfortable and unfamiliar with the obstetric and gynecological procedures and examinations. There's very little exposure for them in the first 2 years of medical school, with only one required standardized patient interaction concerning gynecological examination skills. The gap in training was further exacerbated by the COVID-19 pandemic, when the majority of the preclinical learning was transitioned to a virtual format and sessions with standardized patients were limited. We decided to broach this gap in women's health exposure by stepping out of our comfort zone to collaborate with the Obstetrics and Gynecology Student Society to create a workshop. The two interest groups, along with faculty and residents from both specialties, worked very closely together to plan the event. After much deliberation, 11 topics were finally settled upon. The topics were speculum and pelvic exams, dot tone and sonocyte skills, cervical dilation, vaginal delivery, perineal laceration repair, contraceptives 101, breast exam, IUD insertion, and Nexplanon insertion. With these 11 topics in mind, we created 8 stations that covered 1 to 2 of the topics each. Faculty and residents from either family medicine or obstetrics and gynecology volunteered to help at a station for teaching the students. Models were either created or borrowed from both departments and the Health Education Center to use for our teaching. For the event itself, in adherence to the COVID-19 guidelines at the time, registration was capped at 72 students. The registered students were split among the 8 stations. In addition to volunteers from both interest groups guiding the students through the event, participants received an electronic guide to assist them through the workstations. To assess the baseline knowledge of the participants and the effectiveness of those teaching at the workshop, a pre and a post quiz were administered. The results from the quizzes were analyzed using a two-tailed t-test. Furthermore, an online survey was available for the attending students to provide feedback on the workshop. The results of the quiz and the feedback given were very encouraging. The pre-session quiz average was a 55.4% correct, represented here in our red column on Figure 1. The post-session quiz average was 87.2%, represented here in the navy column in Figure 1. The difference in scores was significant, with a p-value less than 0.05. Some of the feedback we received is listed here on our right-hand side of the poster. The participants were impressed with the event, stating that the instruction they received was great and the environment for learning was relaxed and conversational. They found that the learning was very hands-on and interactive, and students were able to learn terms they hadn't learned yet. In addition to the positive feedback, we also received suggestions on how to improve the event in the future. So, with that in mind, we can address the takeaways and how to adjust our event for the following years. It was shown by the pre and post quiz results that our event was very successful in increasing the students' knowledge about women's health procedures and examinations, as well as the terminology used. The feedback implied that the teaching was easy to understand and hands-on. However, there is always room for growth. It was mentioned that the stations occasionally felt rushed under the time constraints. The groups of the rotating students weren't always in sync, and the administration of the pre-quiz felt hectic. To address these hiccups, we can consider increasing the time spent at each station, implement a universal and central timer, and send out the pre-quiz to be completed prior to arriving at the event. Thank you so much for your interest. Please reach out to us if you have any questions at all.